A special parliamentary committee is looking at whether to extend access to medical assistance in dying to those with mental illness. The government opened up MAID to people who are not facing imminent death in 2021, but that legislation carved out a temporary exclusion for mental illness. Now, that exemption was extended twice by former Prime Minister Justin Trudeau's government and is currently set to end in March of next year. The committee, made up of senators and MPs, has now heard from its final set of witnesses, and based on what they heard, they face three choices: pause the expansion indefinitely, pause it for a finite period, or allow the expansion to go ahead. Prime Minister Mark Carney says he has not yet formed his position.
What is your position? Do you support?
I like to take informed positions, and I wait for the informed decisions.
Okay, here with me is one of the members of that committee, Conservative MP Michael Cooper. Mr. Cooper, it's good to see you, sir. Thank you for coming in today.
Good to be with you, David.
So the Prime Minister says he's waiting for your committee to deliver a report that's not due until October, but you're saying you're hoping to have it done before the House rises for the summer. Do you have enough information, and do you have a sense that whether there is a consensus or not on the committee on what to recommend?
I can't speak for the committee, but I believe that based upon the evidence that we heard, that the course that the government needs to take is to put an indefinite pause on this planned expansion. There are two fundamental clinical issues that remain unresolved at this time. The first is accurately predicting irremediability. In other words, it is difficult, if not impossible, to predict whether someone with a mental illness can get better. And what that means is that if this expansion goes forward, persons who could get better, who could go on to lead a healthy and happy life, could have their life prematurely ended. Secondly, we heard that it is difficult to properly and accurately identify and distinguish a request for MAID that is motivated by suicidal ideation and one that is rational in the context of MAID for mental illness. And that is underscored by the fact that in about 90% of suicide deaths, there's a mental health issue at play. So for those reasons, until those issues can be resolved, it can't go forward safely.
But what are you hearing at the committee on how you can resolve those issues? Because I remember speaking with people who work in the mental health space, and they had issues on consistency of making that assessment, which speaks to your point, and they wanted this delay so that they could up their training standards. What is it that needs to happen that you can be satisfied those 2 points could be met?
Well, according to leading psychiatrists who gave evidence before the committee, that issue cannot be resolved at this time. There is simply no objective criteria to determine irremediability. In fact, one leading psychiatrist said that it's like flipping a coin, or even less accurate than flipping a coin, less than 50% accuracy rate. So when we're talking about something that is a matter of life and death, when a procedure such as MAID is carried out, there is no opportunity to do a do-over. It underscores why we need to proceed with caution. And in the face of the evidence that we heard, it simply should not go forward this March. And given that this government has had two kicks at the can, so to speak, and twice has had to bring forward emergency legislation to delay implementation, with the same clinical issues being unresolved, with no evidence that they can be resolved in the foreseeable future, it demonstrates that the appropriate, responsible course of action is to put an indefinite pause on this.
But the irredeemability part, and I am not suggesting this is not a complex and difficult issue for parliamentarians to grapple with. What's the time horizon on that? Because I look at the case of someone like Claire Elise Brosseau, who's gone to court. She says she's been dealing with the consequences of bipolar 1 disorder and PTSD for 30 years. Maybe she, but it's 3 decades, and she is asking for a personal exemption to this exemption so she can choose to end her life. I mean, how do you calibrate that, Mr. Cooper? That's a tough one.
It is tough. These are tough issues. But what we heard is that many persons suffering from mental illness can get better even after prolonged periods of time.
But 30 years?
Well,
I mean, what's the time frame?
Well, what we need to do is work to ensure that persons suffering from mental health can get the help and support that they need and that they deserve. And we know that there are gaps in terms of mental health supports that have to be addressed. On the question of irremediability, I would add that in order to qualify for MAID under the law as it stands, one must have an irremediable condition. So if one can't accurately predict irremediability in the context of MAID and mental illness, then it is not possible to determine whether MAID in that context can be carried out in accordance with the law, which is also a problem.
Right. So, and just as I guess a final point here. So, I appreciate that. You know, the consequences of allowing it to proceed when there is hope is what you're trying to avoid. But the flip side of that is that someone like Ms. Brosseau has to continue living a life she does not want to live.
Well, when psychiatrists say it's like flipping a coin, that persons who could get better could have their lives prematurely ended, then it's simply untenable to move forward with this expansion at this time.
Right. So I know you say you can't speak for the committee, and I know you have to go and do your work and draft your report. But there was reporting today that the government seems to be anticipating it's going to be a recommendation of not going ahead with this, and maybe that they are getting ready to do legislation to permanently do away with this. I mean, what is your understanding of where the government is on this and where the Liberals on the committee are on this?
I know that there are some Liberal MPs on the committee that are uncomfortable with moving forward. I've talked to other Liberal MPs who are not on the committee who are uncomfortable with moving forward. I hope that the Minister of Health and the Minister of Justice listen to concerns from those Liberal MPs, but most importantly, follow the evidence, including from leading psychiatrists, including the chair of the Association of Chairs of Psychiatry, representing the chairs of psychiatry at all 17 medical schools in Canada, who've said, put a pause on this, put a pause on it indefinitely.
Okay. All right. Conservative MP Michael Cooper, we appreciate you coming in today, sir. Thank you so much.
Thanks, David.
Parliamentarians are weighing whether to extend medical assistance in dying to those with mental illness. Now, before the commercial break, we heard from Conservative MP Michael Cooper, who says this is something that must not happen.
Listen to the evidence from experts that said that this is ill thought out and frankly dangerous.
Obviously, a very complicated and difficult issue being debated by parliamentarians. And joining me now is someone on the other side of the issue, Senator Kristopher Wells. Senator, it's good to see you, sir. Thank you so much for coming in.
It's great to be here.
Michael Cooper is your MP. I learned during the break. What do you make of his position on this issue, which is the arguments that he made?
Yeah, I think we would disagree because I actually don't believe we've heard the evidence fairly in a balanced way, at committee, which gives me great concern because this is such an important issue to Canadians. It's a divisive issue. It's a controversial issue to some. So I think as Parliament, we have to really make sure that we're doing due diligence on behalf of Canadians and getting all of the experts and all of the opinions on the record.
What do you mean you don't feel you've heard it in a fair way at committee?
Yeah, well,
what's happened there?
I think you just see what the media has been reporting about, just the large imbalance in perspectives. For example, we have the Canadian Psychiatric Association, which represents over 6,000 psychiatrists, and they haven't been invited to the committee despite their request to appear and them having to rebut a lot of the testimony through letters. So, to me, that's really an oversight, and certainly, on an issue this way, we have to have all the key players at the table and all of the opinions at the table for committee to make an informed decision.
So you think, the deck has been stacked here, essentially, is what's going on?
My former career as a Canada Research Chair and University Professor, right? Yeah, we have to have the evidence before us to be able to make an informed decision and a report. I'm new to politics, so, and I'm new to this environment. This committee operates very differently than we would at the Senate, right? Senators are independent, we're nonpartisan, so we're looking at the information, we're looking at the best evidence available, the quality of the evidence presented to be able to try to make an informed decision, regardless of what that decision is.
Right. So where are you on this? Because obviously Mr. Cooper is very clear on this. He has been for several years, and his argument that if you make this choice and there is hope for someone to recover, it resonates for sure. He seems to think there's going to be maybe a report before Parliament rises in June. Where do you think the committee is in this deliberation? Is that a reasonable target?
Yeah, I think it's a bit rushed. If it were my choice, and I certainly recommended this to the chairs and to the clerks, that we add more time to get these opinions on the record, right? We have to get this decision right, so we need to take the time that's required. If that means sitting longer in June or over the summer and the report comes out in the fall, let's take the time. Let's not rush this decision. So I think there are 4 choices really right before us. The first is lift the suspension, and this goes into effect
next March.
Right, next March. And there are several legal cases already underway that are going to have great influence, on this decision. The second one could be send for reference to the Supreme Court of Canada. We've done that in the past on controversial issues. Same-sex marriage was a great example, right? There wasn't consensus. We started to see different provinces take different positions. 20 some years later, we don't even think about that decision. That's a core Canadian value, but there wasn't consensus at that time. Abortion, there wasn't consensus in the medical or healthcare community at that time, and now we see that as a fundamental Canadian right. The third one is pass legislation which would actually rescind the right for persons who have the sole underlying condition of mental illness, mental disorder, from being able to access MAID. So there's 3 that's
or you can pause it yet again for further study.
Well, that's just it. Kick it further down the road, like it's happened twice, and don't resolve the issues. And I think that does an injustice to Canadians, particularly those who are looking to have access to continue to suffer.
Are you in favor of letting it proceed? Is that where you are at this point in time? Because you mentioned legal cases. I referenced this in my conversation with Mr. Cooper. People like Claire Elise Brousseau, who she has been dealing with bipolar disorder for 30 years, and nothing has worked. And that is what is the time limit you give it? Right?
Well, exactly. And she should have been invited to testify at the committee and was not invited, and certainly wanted to come. And it was a name I certainly suggested along with many other senators. So you can see part of the problem here. If we want to consider this the evidence base, it's very flawed.
So who's stopping these invites? Help me understand that, because I will confess I did not know the Canadian Psychological Association was not invited. That seems to me a somewhat obvious guess because we see all kinds of people going to parliamentary committees, some frivolous, some serious. This seems relevant. Why isn't this happening?
Well, it's a great question, and only one the co-chairs can answer, because it's again, I'm new to Parliament, but certainly the committees I've been on don't operate in this way, that the steering committee would come together with all the diverse political perspectives, including senators, and they would select a balanced panel from the witnesses that the whole committee had selected. But unfortunately, we have 2 co-chairs that have a long public track record against MAID. So that does, as you've heard in the media, wonder how was bias entered into the decision making, in this committee. And it's something that hangs over whatever the report of this committee will be. So I really believe we should be adding more testimony to ensure that this is a fair, balanced, objective panel that then can inform a fair, balanced report with recommendations that then the government can consider.
Well, it sounds like, Senator, if this does go ahead in June, as Mr. Cooper said, that they come in months early, I don't know the last time people got their homework in this early on a topic this difficult, that it will be with some pretty serious dissent. I mean, how you and others on the committee, how widespread is this on the committee in terms of the frustration with the process here?
Well, I think it's come down to a frustration where many committee members have considered resigning because they don't want to be complicit in a process that can be interpreted as being flawed, right? Others have chosen to stick through the process to ensure that that those voices are at the table, and certainly is a right to have a dissenting report. Don't know that that's necessary yet. We don't want to presume the outcome of a report and the kind of recommendations. We have a lot of faith in the clerks and the teams that end up drafting these reports and bring them back and take direction from the committee from all of those perspectives. But ultimately this should not be a political decision. This should be a decision based on evidence, based on expertise, and I just really feel we haven't heard all of that to come before Parliament.
Just as a final point, I mean, it shouldn't be a political decision, but it is a decision that will be made by politicians.
Yeah.
And we heard the Prime Minister there today, who leads a majority government, saying that he wants to make an informed decision based on the report. But if this process is flawed to the degree you have outlined and you have discomfort with it, what would be your advice to the Prime Minister on how to do this?
Exactly. I think, I share that expectation of the Prime Minister. He's been very clear, right? He expects people to work. He expects people to work hard to produce the very best product, the very best, laws and legislation informed on evidence and professionalism. I think lived experience is absolutely important. I would, really look at the whole process carefully and decide whether you want to send it back, do your homework again, right? And make sure that that it is a credible process. That is it has to stand rigor.
So, but do you think? And sorry, I know I said a final point. I can ask one more final point. Do you think, based on what you've seen to this point, as someone who's a Canada Research Chair and a researcher, you know the rigor of good process. Do you think he could make an informed decision based on the process to this point that will inevitably inform whatever comes from your committee?
Well, I have concerns of the process thus far. I will reserve my own judgment on the final report and where the recommendations lie. Again, this is just simply advice, this report to the ministers and to the Prime Minister. But, I'm always happy to chat with the ministers, with the Prime Ministers. Again, I'm not part of a political party. My vote can't be whipped. I come at this as a very independent, but with very seriousness and great respect. But also, I'm a strong believer that evidence should inform policy.
Yes, especially on something like this. I mean, this is a difficult, I can't imagine a more difficult issue for parliamentarians to grapple with than the framework on to end someone's life.
But this is the expectation of Canadians and why we're here. And we've dealt with difficult issues in the past. And I think, we owe it to Canadians to do the very best job possible.
Senator Kristopher Wells, it was good to meet you, sir. Thank you for coming in today. Thanks so much.